Raj Narayanan. I'm an interventional radiologist at the Miami Cardiac and Vascular Institute and also the Chief of Interventional Oncology for the Miami Cancer Institute. I would first like to thank CRC for having us as a part of the CRC Takeover campaign. We're very excited to share our experience both in vascular and interventional oncology through this week. So today we're going to do a microwave ablation of a patient with the primary liver cancer or hepatocellular carcinoma. This is a 70-year-old woman with a history of primary liver cancer, and now she has a recurrence in a spot in her liver. We're going to be using an ablation technology called microwave ablation, where we use a needle that will deliver heat energy through the tip of the needle, and that will kill the tumor that's involving the liver. We're going to use the Epione Robotic Guidance for the needle placement. We're now going to get the robotic arm aligned with our trajectory. We're now going to use a coaxial needle, it's called a Murphy needle, for us to create a skin incision. Traditionally, these ablations are done freehand with CAT scan guidance, where the operator would make adjustments to the probe from the skin to the target. Recently, a couple of months ago, at MCVI, we started the first robotic assistance program in the country using the Epione robot. And with this device, we're now able to plan the trajectory from the skin to the target, and we're able to advance the needle with just one push, rather than having to do multiple adjustments and check scans. So we're done with our treatment, and I just want to show the size of the incision. As you can see, it's about a couple of millimeters, and that's the size of the incision that we make to treat the patient, and now we're just going to use a bandaid. This was a very successful procedure, and we just confirmed the ablation zone with a contrast-enhanced CT after the procedure to make sure that we got the lesion along with a good margin, and also make sure that there were no complications. MCVI has always been in the forefront of incorporating cutting-edge technology into our day-to-day clinical workflow. I think talking to patients and their families after a successful outcome or a successful procedure is one of the most gratifying parts of my job.